thank you so much for joining us for this very important conversation on the sidelines of the UN General Assembly, Mind Matters, Shaping the Future of Mental Health. I'm Kate Warren, Executive Vice President and Executive Editor at Devex, and we are delighted to be hosting this event in partnership with Boehringer Ingelheim on an issue that doesn't get a lot of attention. I think we've seen a real growth in attention and funding and awareness around mental health broadly. But that bucket is quite large, and things like wellness or taking a day off from work often falls under that very large umbrella. And what gets overlooked is the real acute needs of those with severe mental illness. So that's what we are going to be diving into this evening. We have a really exciting program for you, very interactive, and I hope you all have a chance to mingle and get to know each other. We'll share a little more about the program in a moment. But to get us started and set the scene, I'd like to start with a short film, Real Life with Schizophrenia, Stories of Connection, Community, and Care, that comes from this documentary. So we'll tee that up now. Thank you.
Oh, you're supposed to be filming.
I'm supposed to be filming, and I'm filming Derek. There's Derek doing his dinner.
Schizophrenia is life-changing, mind-numbing. You have your son, and then the psychotic episode hits, and it's almost like you've lost that person, like they're gone.
Schizophrenia is where you have difficulty with reality, determining what's real and what's not real. Symptoms like hallucination or delusions, and then it affects more of your cognition and your thinking ability and being logical.
My voices in my head were incredibly powerful. And I remember if I didn't scream like they told me to scream or hit myself like they told me to hit myself, they'd just get louder and louder and louder.
一緒に言葉が詰まるような感覚っていうのは長く続きました。お相手の方が言っている言葉の意味っていうのは分かるんですね。ただそれについて自分が考えていること、感じたことを言葉として発しようとするときにそれがうまくいかないような感覚があったりだとか。
Vor der Schizophrenie war ich Klassenbeste und nach der Diagnose habe ich leider nur noch sehr wenig verstanden und konnte mich nur noch sehr schlecht konzentrieren auf die Schulaufgaben.
In some countries, the diagnosis can take 2, 3, 4 years, and that's a very critical time in terms of what might happen to the person in those so-called critical years, those chaotic early years.
It's an absolute necessity that if someone in your family develops any mental illness, that you learn as much as you can about it so that you can maintain a relationship with a person, and that's possible.
If you could go at the negative symptoms, if the medications coming out in the future would help him just talk to people, that would be absolutely life-changing for us.
This one here? Yeah. Copy. Cognitively, yeah, it's a challenge most of the times. If I'm told to memorize something, that's a big challenge. So usually I have to write things down and then read from there.
He's just slow in taking instruction. He knows how to use a computer, but if I'm standing there and I tell him to look for something, probably he won't get me easily.
Él se pone a leer o a ver televisión y si él ve una palabra que no entiende, ¿qué quiere decir eso? Como que ve una barrera en alguna palabra y pregunta.
Voy tratando de reconstruir la palabra que no entiendo. Cuando no entiendo algo se lo pregunto a Zenaida, pero casi siempre yo entiendo. Casi siempre entiendo la palabra correcta.
People can get better. Recovery is possible, but it takes the whole family and the community.
Ja, also wenn ich einen Rat geben würde, würde ich sagen, bleib damit nicht allein. Such dir Gruppen, such dir Menschen, denen es genauso geht. Also mich hat da tatsächlich eben auch diese Psychosen- und Schizophrenie-Gruppe motiviert.
Si hay alguien que tiene algún paciente, que no lo abandone, que Marco tiene ya 30 años, casi 30 años con esta condición. Y Marco hace vida normal en un 90-80%.
Ideally, one day we will have a drug that will improve cognition, and I really, really hope to see that during the course of my life.
Thank you, and you'll be able to hear from one of the stars of that film in just a moment. But I'd like to welcome to the stage Nadim Papich, who is the Global Head of Mental Health at Boehringer Ingelheim, to get us started. Nadim, over to you.
Thank you, Kate. Good evening, everyone. I want to warmly welcome all of the attendees and also the panelists to today's event, Mind Matters, Shaping the Future of Serious Mental Health Care. We are addressing one of the most pressing issues in global health today, serious mental illness, and certainly a global pandemic affecting us all. And this event should represent a crucial opportunity to actually raise awareness on the challenges of those individuals who face it every day, to face the serious mental health conditions. And I think you've seen some of the beautiful examples, the real life experiences in the stories. And we will talk about schizophrenia today when you look at the real life experiences, but obviously there's so many more disease burdens coming from major depressive disorder or PTSD as well. I think today should hopefully also allow us to discuss and consider how cross-sectoral collaboration can truly make a difference in tackling the serious mental health care challenges, and also provide ideas to drive action to increase investment in mental health care, and also to improve innovation, especially ahead of the UN high-level meeting on NCDs and mental health in 2025. The event in general was planned, and you've seen the start, to deepen our understanding of the issue through stories shared in documentary shorts. And I think also a personal thank you to Bethany, who you will meet later and you saw in the video, but also to everybody else who participated and really shared their personal stories and experiences of connection, of community and care. And I hope that you will also take the time a little bit to go through the photo exhibition, but also discuss among yourselves. I think sometimes it's exactly those experiences that bring to light how it is to live with schizophrenia in that case in different parts of the world. And it should also inspire us to advocate for more robust mental health policies. At Boehringer Ingelheim, we are committed to advancing treatments for serious mental illnesses, and we do believe it's crucial to drive this urgent need for change, both in research, in innovation, but also in general, how mental health care is provided and how we can all maybe also improve the whole access. And you've seen the examples go from developing to developed countries. It really affects us across the globe. Now, allow me to introduce a short segment, and again, two stories on hope for change. One featuring Professor Tsuyoshi Akiyama, who is also the president of the World Federation for Mental Health, and Bethany Iser, who you had the pleasure to already see in the beginning, who is also the president of the Cures Foundation and is sharing her lived experience. The videos in general in the stories, they should be thought-provoking, and they should actually provide valuable insight into current mental health landscape, and hopefully also inspire us to discuss how we can drive change for all. Thank you.
I am a father of a son who committed suicide due to schizophrenia, but I'm a psychiatrist myself too. If you or your family are told you suffered from schizophrenia, I believe many people will receive that as the end of life statement. But that is not the reality. That is not the case at all now. So you should learn and understand all the possibilities and options that you can enjoy, even with this illness condition. And I hope that many people can continue doing efforts and enjoying life. If someone has self-stigma, then we cannot fight against self-stigma, almost by definition. If you are told you suffer from schizophrenia, you suffer from bipolar disorder, substance dependence, then people will develop self-stigma. And the people, staff, who are supposed to help them should never strengthen the self-stigma. This is a worst enemy for the possibilities to realize appropriate future for the people who live with mental health conditions. The support for work capacity may not be developed in many countries, including so-called advanced countries. People with mental illness do not lose their capacities. And when society sees many people with mental illness can actually continue working, meaning contributing to the workplace, to the corporation, or to the society, then it will automatically decrease stigma against mental illness. The government should help psychiatrists and mental organizations to do PR that schizophrenia is a curable condition. Because this is the first and most important messages to the people and the family, and also people around the person. I hope that many governments will pay attention to these opportunities for the society.
Thank you. Well, I would love to welcome to the stage, we have Bethany Yeiser, who you will recognize from the first film. So documentary star and president of the Cures Foundation. And we have James Sale, who's the deputy CEO for United for Global Mental Health. So thank you both for being here. So Bethany, I want to start with you. Yeah, let's get the, there you go. So I want to hear a little bit about your story, your journey, and we talk about how the global mental health is a global awareness, but there's a lot of different buckets within mental health. And could you talk about what makes patients with schizophrenia unique within this space?
Well, hi, my name's Bethany Yeiser, and I stand up before you recovered today, but I'll tell you right from the start that this was not supposed to happen. When I was diagnosed with schizophrenia in 2007, my first not one, but 3 doctors said I was permanently and totally disabled. I have so much respect for the Japanese doctor who says we need to understand that schizophrenia is a treatable condition. We need more celebrities in our society standing up and saying, I've dealt with schizophrenia and I've conquered it. I've moved on. We need education among the general public, and we even need education among psychiatrists to help them understand that this is not a hopeless condition. You asked what makes people with schizophrenia unique, people with serious mental illness unique. One thing that is specific to this group of people is they very commonly have no idea that anything is wrong with them. This is called anosognosia. It means denial, but it's more than denial. It's a very ingrained belief that they do not need help. That makes this population very hard to serve. They're not going to show up at your clinics like patients with anxiety or depression. And very unfortunately, another thing that makes people with serious mental illness unique in the United States is that you find so many of them incarcerated in jails, and you see so many of them homeless. In the United States, we unfortunately have something that's sometimes called the revolving door. People may be sleeping outside in the streets. I was doing that for 13 months. They get very, very psychotic. They may be briefly taken to jail. More than half of people with schizophrenia are incarcerated at least twice, and I am one of them. I remember being a student at USC in good standing, and years later, I thought I had the right to wander around the campus looking for garbage to eat. You would think that someone would pick up on that and realize that I needed hospitalization and help. So I was briefly jailed, and then I just went back to the street. It was the life I knew. My parents, my loving, wonderful family, could not do anything. Everything changed for me when I was picked up in 2007 and taken for an involuntary hospitalization, which I hated. I was not happy there. But of all the things that have happened to me during the course of my life, the involuntary hospitalization is what I am most grateful for. Because of that hospitalization, I would begin medication. After a couple months, I would realize I needed that medication. And because of that medication, I was able to go back to college, graduate with high honor. Today I work. Thank you. Today I work, I live independently, I have a wonderful circle of friends, and today I have actually transitioned to being off Social Security income, completely self-sustaining. So my hope is to offer the general public, even our psychiatrists, more education. And I will mention one more thing. As we talk about education, there's a topic that's very important that I believe should be emphasized: marijuana. If you decide to smoke cigarettes, you know the risks of lung cancer. Everybody who chooses to experiment with marijuana should know the risks of psychosis. Marijuana can turn on psychosis like a light switch. But for many people, that light switch can never be turned off. I see so many people in my advocacy work who tried marijuana, and now they will probably be on antipsychotic medication for the rest of their lives. So as we educate our leaders, our students, let's also pay attention to that issue. Thank you.
Thank you, Bethany. And you talk about why you're able to be here today and talking with us. Both you had the family support, yes, but also the system support. Not everyone is able to have both, but how do you see both of those playing with each other? And what do you think, particularly for some of the leaders in the room that are working on policies, systemic issues, what would you like to see change?
Well, one of the reasons I had such a great recovery is because my parents would not give up. When I was taken for my involuntary hospitalization, I hadn't seen them in close to 5 years. They did a wonderful job raising me and my brother. I was totally paranoid of them. I was delusional. I thought I was going to be the next Mother Teresa. And when I was taken to that hospital and they were considering keeping me for the hospitalization, my mom called and she basically said, I know Bethany's in your hospital. I know that you can't tell me that she's in your hospital because of HIPAA, the Health Insurance Privacy Act in the United States. But she said, I know Bethany's there and I want to tell you what's happened in her life over the last 5 years. I got out of that hospital and I was done with medication. I had no idea how much it was helping me. And going off my med led me quickly to be hospitalized again, and my parents had to call 911. And today I'm so glad they did, because that was part of my journey to recovery. Another thing that was extremely important was the doctor I met named Henry Nasrallah. We founded the Cures Foundation together years later. I come into his office, I'm staring into space, I'm restless, I have this blunt affect, I've had all these medication-induced side effects, and I can't focus, I'm very unwell. But Dr. Nasrallah, he took the time to research me. He knew I'd won a big scholarship to attend USC. He knew I was interested in molecular biology and biochemistry. He knew I'd published 3 papers prior to my diagnosis. And Dr. Nasrallah didn't just see all these medication-induced side effects and write me off as a hopeless case. He saw deeper. He saw my potential. He saw who I used to be. And he made it his mission to get me better. For him, that meant getting as close to my baseline as he possibly could. And today I am living very close to my baseline, thanks to him. In my case, it was also cutting edge and underutilized medications. In my case, it was clozapine. So as we treat this population, it's also absolutely important to use clozapine, to use long-acting injectable medications which are extremely effective at preventing relapse, and see what's new in the market for your patients.
Thank you. And so James, I'd like to bring you in and talk about how are you working with governments to ensure that severe mental illness, like schizophrenia, PTSD, major depressive disorder, are prioritized within the mental health agenda and policies?
Yeah, thanks very much, and thanks for your story, Bethany, as well. So I work for United for Global Mental Health. We're an advocacy organisation. And
some fans in the audience.
Our former trustee just happens to be over there. No, thank you. So I think it's undeniable the rise in attention on mental health that we've seen over the last few years. In fact, many people say to me, oh, that's because of the pandemic, right? I don't know if that's entirely the case. I actually think that the trajectory was long before the pandemic. If anything, it accelerated it, but there's a sustained increase in attention on mental health. But that's not necessarily translating into dollars and cents, and it's not necessarily changing into the progressive policy and legislation that we want to see. When I talk to other mental health advocates and campaigners, we used to talk about how when we come to things like the UN General Assembly, what's our goal here? And I used to think simply, do you know what? I just want it to change from mental health being noticeable by its inclusion to mental health being noticeable by its absence. And I think we're getting there. I think we're moving in that direction, but we can't let up. We've got to keep going. So it's about harnessing that increased attention. In terms of approaches we can take, we've got to think about integration of mental health. And that's within the health sector, so integration of mental health into physical health conditions, into non-communicable diseases and how we approach those. So we have a people-centered approach. A patient who has a diagnosed non-communicable disease and a mental health condition, they don't particularly care about the global policies on where mental health and where NCDs sit and where infectious diseases sit. They just want to be treated for them as a person and in the whole, right? So we need to talk about integration. But that also includes outside of the health sector. So we need to be looking at mental health in all policies. Mental health in the education sector, or you mentioned the justice system, or social welfare approaches to people as well. We need to be including mental health in all of this. Integration is a key point. And then we've got to look for entry points. If you want an articulate, eloquent, passionate conversation about mental health, speak to someone younger than yourself. Speak to someone that you would consider a young person, because I guarantee they'll teach you something fantastic about mental health, and they'll speak to you in a way that just makes it feel so effortless. And we need to do more of that. So entry points, let's speak to young people, and let's recognize that young people are the experts of their own lives. They want to talk about mental health and they want to see action. they want to be given that platform, but they also want to be listened to. We're involved in an initiative called the Being Initiative, which is prioritizing adolescent mental health by looking at young people's ecosystems and what really affects them, how they interact with the people around them and the environment around them. Let's let them lead on things like that. And just very quickly, the high-level meeting on NCDs and hopefully mental health is happening next year. The vast majority of that conversation will be about things that touch on all NCDs and mental health. It will be about universal health coverage, domestic financing, external financing. But there will be things that are unique to mental health that we need to make sure are discussed. For us, those are things like suicide prevention, including the decriminalization of suicide. There's 23 countries around the world where suicidal behavior is illegal and criminalized. When people are in most need, they are punished, not supported. And also, you spoke very eloquently, Bethany, about involuntary institutionalization. There's too many countries around the world where the majority of the mental health system, in fact, basically the entire mental health system, are long-stay facilities, tertiary level facilities where people are held on indefinite terms. I visited one in West Africa a couple of years ago, and the staff were very pleased to tell me that a couple of months ago they stopped shackling people to their beds. There's no need for people to be shackled to their beds. And a lot of people I spoke to there was absolutely no need for them to be held in a facility like that on an indefinite term. We hear about case studies of alcoholics being held in mental asylums. There's no need to treat an alcoholic in a mental asylum. There's no need to be held there. So there's a huge number of issues that are unique to mental health. These need to be discussed, and those are the entry points that we should be having at things like the high-level meeting, and we need to be giving people like young people the floor to talk about those.
Thank you. So just for closing, Bethany, I would love to hear, I was struck by your story really talking about, we're talking about systems and policies, and that's really important, but what was really critical to your care was having a doctor who knew you and treated you as a person, right? Not as a patient, not as a policy, as a person. So what would just be your advice to people in the room as they're thinking about centering the person in these overall policies?
You have to never give up on your patient. And, I would also say a really important thing that's not discussed enough is that if you go off your antipsychotic medication and back on it, it can be less effective or ineffective. So I remember my first doctor, I didn't like him very much, but that was one of the things I wish I had been told. So you want to give your patient a little bit of education about schizophrenia. I didn't know it was a physical condition. I thought, mental health, that means you're weak or you have a low IQ or you're eccentric. I didn't know that it was a physical condition, and I didn't know that with medication you can actually cure these symptoms, that you can actually get to a point of remission. I didn't know that I could be on an antipsychotic medication that allow me to go back to college and finish college with really high grades. So this is really important for patients to know. And I really think that, in high school, when kids are learning about healthy sleep, diet, exercise, healthy sexual health, that they should also learn a little bit about anxiety, depression, bipolar schizophrenia, that these conditions affect 1 in 5 of us, that there should be no hesitation in accepting help. So, very important.
That's great. My son is a senior in high school, and he started the mental health club at his school, so I'm going to flag this for him to make sure they're incorporating. Well, James, Bethany, thank you so much for your time.
I see stigma all the time. There's just a lot of misinformation. When I was diagnosed with schizophrenia, the doctor took my parents aside and said, Bethany is permanently and totally disabled. She will not go back to school, she will not work, she will not live independently. This is in many ways the end of her life.
誰もがやはり暮らしたいところで自分らしく生きていくってことは大事なことだなと思っていて、そういった人が地域社会に戻ってきてほしくないというふうに、やっぱそういった目的、前提がどこかにあるようで、 やっぱそういったスティグマの問題ってことにしっかりと向き合わなきゃいけないって考えてるんです。
A person might say things like, well, we can't afford any more investment in mental health care services because this seems to be an enormous amount of money for very little effect. I think decision makers need to see mental health and social care expenditure as an investment rather than a cost. And they need to understand that the return of that investment is an improved quality of life for people and also an improved social and economic position for the country.
So we could be a far more compassionate society. It's going to cost you anyway, whether it's long hospitalizations or whether you spend it on infrastructure to give people a better quality of life. No one should be penalized because they have a mental illness.
Great. Well, I would love to welcome to the stage our next panelists. We have Beck Smith, the Associate Director of Policy at Wellcome, Devorah Castell. I love all the hype that's in the room tonight. This is great. Director of the Department of Mental Health, Brain Health and Substance Abuse at WHO, and Dr. Mohammed Hamad Al-Thani, who's the Non-Communicable Disease Prevention Programs Director at the Ministry of Public Health in Qatar. So thank you all for joining us. Great. Well, I want to. I'll start with actually you, Devorah. I want to talk about. We just saw in the film, and Bethany talked earlier in the panel about the role of stigma. And so, what are you all doing at World Health Organization to try to reduce the stigma around serious mental health, either within the global health system or within patients and communities?
Great. So thank you for having me today and for this opportunity. I think that we work from different perspectives. And when we talk about stigma, traditionally, people with mental health conditions, more or less serious, as we say, which is a weird way of defining something, right? What is not serious here. But then traditionally they were segregated and sent to psychiatric institutions and then forgotten there for decades. And in many cases it's still happening. So in a way that also generated the stigma on itself. What we didn't know about mental health or people with mental health conditions because they were far away and secluded and segregated. So one key strategy in order to fight stigma, and is what we are trying to do, is to have people with mental health conditions in the communities we live with. And so one of the strategies that we use at the World Health Organization is trying to transform the systems, the mental health systems in countries, so that anyone with any mental health condition can receive the care they need in many diverse ways and possibilities. I hope I will have time to come back to that. But then other strategies is, of course, we engage with 194 countries we work with. So we bring the discussions around mental health to the settings where we are, the World Health Assembly, the integration of mental health with many other conditions, the discussions that were mentioned earlier in the context of the UN General Assembly on NCDs. Then also the promotion of different tools and strategies that are specifically targeting issues of stigma and how to educate, re-educate the world around these issues. I think I'll stop here as a first round.
Great. So, Beck, we talked a little bit about just kind of the lack of funding, particularly in serious mental health, but mental health overall. So at Wellcome, what are you all doing to help increase not just awareness, but actually funding and action around mental health?
That is a great question. Thank you so much for having me, and thank you for giving us proper food. It's really nice to be at an event that isn't just tiny food that you're trying to intercept. So some of you will know that yesterday there was a big announcement at the Clinton Global Initiative, which was the launch of the Coalition for Mental Health Investment. the Coalition for Mental Health Investment feels like a really important step forward for mental health. It brings together founding partners, the Africa Venture Philanthropy Alliance, ourselves, Welcome, Clinton Global Initiative, McKinsey Health Institute, and also Kokoro. And I actually want to take the opportunity to point out the person you've heard whooping, Natasha Muller, who is the founder of Kokoro, but is the person who really kick-started the Coalition for Mental Health Investment, so huge kudos and thanks to her. The ambition for CMHI is that within a generation, investment in mental health matches the need around mental health. And that means that we need to have new people around the table talking about how we are going to fund mental health. We want to see mental health as attractive, viable, and a scalable investment opportunity that really pulls in the full range of public and private capital. That's something we're not seeing to date, but we think there's a real opportunity for that to be completely different. So yesterday's launch is just the beginning of this. So anyone here who is interested, wondering how they can invest, get more involved in mental health, we would love to hear from you. Our website launched yesterday, mentalhealthinvestment.org. Please speak to me, Natasha, I see Erica from McKinsey Health Institute, people are waving. Please talk to us because I think there's a real opportunity for a step change in mental health funding so that we can close this really significant $200 billion funding gap that we currently have to really see some progress made.
Great, exciting. Yeah, thank you. So Dr. Mohammed, do you feel like a rock star up here with all these clappings? This is great. So Dr. Mohammed, Qatar has increasingly been very active in global health dialogues, and particularly in mental health. And so how is your country prioritizing mental health, particularly serious mental health illness? And can you talk a little bit about your public health strategy and what successes you've seen so far?
Yes, thank you, Kate. Thank you for welcoming me here, and thank you for all people who are trying to make the world more beautiful and wonderful. So we are glad to be here all together, and we are hoping to see a beautiful world more in the coming decade. As you know, Qatar was active, and we are trying to have strategies. We were the first country in the region to have a vision 2030, and by this vision, we addressed most of the public health diseases, and one part of mental health. We have a 16 health area, and we focus on mental health because we believe that mental health is affecting every home. We cannot hide it anymore. Every home is affected, and it's not only it's affecting the person, is even it's communicating to the family, and the family can be depressed if this person in the family is sick. This is always hidden in our region, in our culture. They hide it. They are afraid that the girl, if somebody know about the woman or the man, they will not marry from the family, or the family will be affected. So we started going against stigma, and we've invested in online phone and some awareness campaigns. We are still moving forward on this to be accepted more in Qatar. We have the WISH, which is World Health Summit for Health. We do it, and we welcome Michael Phelps, who said that I was depressed for some time. All these gold medals, and he inspired many people to be more brave and to speak about themselves after this session. We are hoping, Qatar, that our vision for 2030, mental health will be more supported. Not only, we have 7 elements of awareness, data collection, quality clinical communication, patient empowerment, research, partnership, a public-private partnership. So we're working on all these levels so we can work to deliver more. The good luck in Qatar, maybe it's the first country that will be connected all in one electronic system. So you can see the practice of the patients in the private or the public. We keep the privacy, but to assure that there is not everybody is supported in the proper protocols through agreed guidelines. We have maybe 100 nationalities practicing medicine in Qatar, but we are assured that they're having guidelines to assure that the patient have the best practice. In the same time, we are the most country known maybe in the world investing in supporting autism. So we are caring about autism and having different types of support for autism for people. And now we can feel that not only the patient, the family should be supported too. We did this in cancer, and now we are doing it in mental health. There's many issues we can compare how much we are learning from other diseases and CDCs and NCDs, how we can work on mental health. I believe that really it's so clear that every investment, every dollar in mental health will come back tens than this dollar. But we'd like sure that the government should know that very well, and we need to start prioritizing the best interventions that we can do. Thank you.
Thank you. So, Deborah, going kind of back to, well, the funding issue, only about 2% of global health budgets go towards mental health, and many of that to psychiatric hospitals. And, I was really struck with talking with Bethany earlier about how involuntary institutions really help save her, yet that is very stigmatized, right? And it's a tricky topic. And here in the U.S., it's something that we did away with for many good reasons, but without really any good backup, right? What did that lead into? And I was struck about hearing from Bethany and others in the video how much having community, family support, a doctor who knows them, is there on their team, is really critical to good outcomes. So how are you thinking about really encouraging and working with governments to support more community-based care?
Thank you, and you gave partially the answer, so thank you for that as well. So my answer should be shorter, but no, I will go a bit further. One of the strategies that we are following is we came up with a program that is called Special Initiative for Mental Health, and what we are trying to do in a number of countries where we started this initiative is to show by doing how you need to transform the system, because the old-fashioned psychiatric institution where people live there in very bad conditions with regular abuse of the human rights for decades, they are not providing any answer. And then they consume all the budget and you have no resources available at community level for all other people that need support. So we are trying to transform the system to make sure that mental health is integrated at primary care level, that is available at the community where people live, that the general physician or a nurse understands and is able to provide some answer to the needs of that person, no matter the complexity of the condition. And then if the situation is difficult to follow up, then maybe there is someone who knows a bit more and can go deeper into the assessment and the treatment. But the needs are way beyond one answer. So for somebody, the medication might be important, or the admission in a hospital. For many other people, it's not. You need a job. You need to be able to continue with your studies. You need to be able to have someone to talk to. And that, again, that goes beyond what is serious and what is not, what diagnosis you have and what is not. So we are trying to transform, to show how to transform these services. We started in 9 countries, and we have increased by 60 million the number of people who now have access to mental health care if they need it. So it's a massive transformation. And the integration of mental health with other conditions, communicable diseases, non-communicable diseases, but also life course, children, older adults, a woman expecting a baby. I mean, what is the mental health role in all this? So that's one strategy. Then, of course, we also do, that's responsibility of the World Health Organization, we develop guidelines and we bring the science to be accessible to everybody, no matter what, for free. And we also do some capacity building on how to use those tools, right? The integration in primary care that I mentioned, but also psychological interventions that are developed and targeted for low or middle income settings. We have some specific campaigns and capacity building in different corners of the world in order to make sure that if you are doing something good down there, the neighbors on the other country hundreds of thousands of miles away knows and can learn from there. So that's also something that we do. I could continue if you want. Maybe.
Love it. Well, bringing you back in, I would love to hear from your perspective, how you make the case for, there's a lot of competing demands, right? We're here in New York alongside the UN General Assembly. There's all of these SDGs that we're behind all of them. And so how you make the case for investing in mental health, and what are some of the data points that you use or stories you tell to convince whether funders or governments why this needs to be a high priority amongst many other competing priorities?
That is a great and massive question. So from a Wellcome Trust perspective, all roads lead back to science. So for those of you that don't know, we are the largest non-governmental funder of mental health research in the world. And we're focused on 4 global health challenges. We announced a couple of years ago, we're going to be investing £16 billion in those 4 health challenges over the next decade. So there's serious money flowing into mental health research to the extent that we haven't seen before, and that's really exciting. So we're focused on... Not my personal money, but thank you. We are focused on developing and improving early interventions. And when I say interventions, please know that I mean from the cellular to the societal, and there's a whole breadth of mental health interventions that need to be considered. We're focused on anxiety, depression, and psychosis, and very importantly, we do this by embedding the knowledge and expertise of those with lived experience in the research that we fund. We think that is critical to the success of new interventions. So where we are at the moment, and as we have heard this evening, is that severe mental illness can really hold people back from the lives that they want to live, and that the interventions that we have, some of them can help, but some of them help at the cost of very significant side effects. Where we want to get to at Wellcome, and the story that we want to tell, is that we think we can have a huge shift in how these problems are seen. So at the moment, they're seen as chronic and intractable. We think that through research, they can be seen as acute. Our ambition is that someone's first episode is their last episode. So we currently have a pipeline of interventions that are coming down. A lot of them are completely different to the interventions that we have now. We have a funding call open for scaling digital mental health. If people are in that space in the room and would like to know about the funding opportunities there, we're looking about funding for about 5 years, between 3 and 7 million. So please do have a look on our website. Closing date is the 5th of December, so you've got some time to think about it. But if we think about this kind of different suite of interventions that are coming through, and the idea that we can think about mental health problems as acute rather than chronic, that allows us to have a completely different conversation about what the impact of mental health problems are, both from the perspective of the individual that's affected, but also the kind of wider socioeconomic conversations that they have. Governments are going to be thinking about mental health as a health problem, but also mental health as an economic problem too, so we need to make sure that we're having the conversation that speaks to both of those things.
Great, thank you. And Mohammed, so thinking from that country perspective, what would be your advice and guidance to others who are looking to maybe scale some of the successes you've had in being able to find that balance between economics and health, and being able to increase both the funding and the political awareness around supporting mental health?
As you know, Qatar is a small country, so it's a good experience to have everything around. It's a full government, but you have a ways to find the solutions. So the healthy thing that we agreed from some time to have more preventive health measures in Qatar. And the country is generous, Qatar has almost free, but we invested more in every sector, and we can see, we prove for them that we invested in vaccination. We have one of the lowest countries in CDC diseases. We invested in tobacco taxes and control tobacco, and 25% tobacco has went down in Qatar. So we're investing now in preventive health. We know we have a special 5-star place for addiction center, and people can go for there anytime they want, and they can leave. This is it's called Nofar. So for the addiction and the mental health, we at last it took us some time to give them a quality buildings, but now they have a quality buildings at last with the other part. But the government is caring about this one, because if you can check in Qatar, it's one of the high-income countries with the lowest payment for health, because we convinced the government that the way we are investing in health, it's helping to lower the cost. The government is generous, but because we are pooling system and we're having some healthy communication between primary and secondary, tertiary care, and we are moving most of the mental health to the primary health care, so the cost is well controlled. So this means the synergism. The word I would say is the synergism. If you communicate properly, they can get a great benefit and get more trust from the government to add more things. The only challenge now for us is we want the families even to take care about their people, not only just wait for the government always to save the day. We want people to be more ready, to be more courageous about their lives, and take care about for themselves and for their family members.
Well, thank you, Mohammed, Deborah, and Beck, so much for your time today.
I mean, I'd like to get a job.
It's hard to find places of employment that would help you.
When I was working, I mean,
you were slow at your job.
Oh yeah, slow at my job.
Basically accepting schizophrenic patients into jobs and supporting them that way and having more of a life as opposed to being in their rooms all day.
Das Sozialleben ein großer Punkt, weil ich bin im Allgemeinen, denke ich, eher eine Introvertierte. Ja, ich tue mich auch schwer in größeren Gruppen, das war schon immer so. Und während der Schizophrenie kam da eben noch dieses Misstrauen. Und ja, mein Arbeitsleben hat die Schizophrenie oder hätte die Schizophrenie sicher betroffen, wenn sich die Erkrankung bei mir chronifiziert hätte. Da hatte ich eben großes Glück.
Well, 70% approximately of those who live with schizophrenia do not work. Ironically, the same percentage wants to work. 70% would like to work. And so we have to take into mind workplace accommodation.
I am off to work. I feel very empowered that I have the opportunity to work. I feel I'm able to support my family, support myself, and basically I feel part of the society as well.
I always thought that I couldn't work full time, but recently in the last few months, I find that I'll do a lot of 7-hour days or close to 8-hour days. As soon as I get up in the morning, before I even get dressed, I'm at my computer. It feels meaningful, and I'm very grateful for that. I think that's really important about technology is the way it's able to network us together. I wanted to share with people what had happened. You know, oh yeah, I had schizophrenia, but I'm all better now. And I applied to start the Cures Foundation. We now serve 200 families through our mentoring program. We're reaching thousands of people with our newsletter.
Also ich denke auf jeden Fall, dass es in den nächsten Jahren da vorwärts gehen wird, weil ja auch immer wieder an neuen Methoden. Es gibt mittlerweile wirklich eigentlich überall Gruppen zum Thema Schizophrenie, also in Social Media.
私は普段ですね、一般社団法人精神障害当事社会ポドケといいまして、精神障害のある人たちによって運営をする障害者団体なんですけれども、一緒に状況を変えていくっていうプロセスを、そういった人たちと作っていくってことを大事にしていただきたいと思います。